Hey everyone, it's Nurse Dani. Each week I answer your questions with either a written response or a video, and here are answers to some of the questions you asked during the week. A lot of pregnant women want to know if it's normal to be constipated, and the answer is yes. Hormones of pregnancy affect so many different parts of your body, including your gut, and it is normal for you to be a little constipated. Let's say you're in your first trimester and you've been terribly nauseated and your doctor put you on Zofran for it. A side effect of Zofran is also constipation, so this is another reason why pregnant women might have constipation issues. So what can you do to get over it? Generally speaking, most women can cure constipation by increasing their fluid intake or drinking more water each day, and also increasing their fiber intake. So just a few examples of high fiber foods. Fruits, most fruits are very fibrous and good for you. Also like prunes, everyone's heard of prunes that help with constipation. Vegetables, whole grains that are high in fiber. So a lot of cereals are high in fiber. Oats, barley, bran, those kinds of things. And also beans and peas. If this isn't enough, then talk with your OB provider and they might recommend a stool softener or other medications designed to help with constipation. Pregnancy brings with it so many unusual discomforts and pains, and some are normal, others aren't. And so if you ever experience something that you're concerned about, call your doctor. And after asking you more specific questions, they'll decide if further investigation or treatment is warranted. One of the first things we always have to rule out if a preterm pregnant woman has pain is preterm labor. And the most common symptoms are lower abdominal cramping, lower backache, abdominal tightening, pressure in your stomach or down in the vaginal area, an increase in vaginal discharge associated with the pain, any leaking of fluid from the vagina, and also vaginal bleeding. If you experience any of these symptoms, call your doctor, because without talking to them and getting checked out, there's no way to know if it's okay and you can just continue to monitor, or if it's concerning and it needs to be addressed. The placenta's location can affect how a woman feels her baby move. Most moms feel their baby's first movements between 17 and 20 weeks gestation, but some might not feel movement until like 21 weeks if the placenta has attached at the front of the uterus, or you'd hear your doctor or the ultrasonographer refer to it as an anterior placenta. It kind of acts as a shock absorber, and so until the baby is a little bit bigger, not all of those movements can be felt by the mother. They might be a little bit dulled. But as time goes on, the baby grows, you should feel just as many movements as a mother who doesn't have an anterior placenta. Now, you asked specifically about a placenta previa and if that will affect how a mother feels movements, and that won't affect it because the placenta has attached over the cervix. That means it's really low. You should still feel movement just like a mom who didn't have an anterior placenta. A placenta previa has different implications for pregnancy, though. For one, it will change the mode of delivery for sure. There's no ifs, ands, or buts about it. A mother who has a placenta previa will have a C-section. And this is for the safety of her and her baby. It goes back to the fact that the placenta is the baby's lifeline, and there's a large amount of blood going to that spot every time the mother's heart beats. So it's highly vascular. If it's right over the cervix, which is the exit, you can't deliver the baby's lifeline first. And if you start to bleed or contract, then it's very likely that you'll bleed a lot vaginally. So these women often end up in the hospital with bleeding episodes before they deliver, and if they haven't had their baby by 36 weeks, most OB providers will recommend C-section at that point to prevent complication as she gets further along. It can be really overwhelming when you go to the grocery store to buy formula for your baby and you see shelves and shelves just stocked with tons of different brands and types. Now, the brand isn't as important as the type, but it will leave you wondering, what type should I feed my baby? And I do recommend talking with your pediatrician about this topic because they'll be able to give you the best advice based on their knowledge of your baby's needs. These different types of formula are made to fit certain types of populations. 80% of babies in the United States drink cow's milk-based formulas, and for most babies, this is just fine. They come iron fortified, and since this has been added in recent decades, it's significantly reduced the number of babies that have iron deficient anemias. So most babies tolerate this and do well. But if you've noticed that your baby is drinking this type and they seem excessively fussy, gassy, spitty, or have diarrhea, especially if they have bloody diarrhea, then talk with your pediatrician and they may recommend a different type of formula. Other types include hydrolyzed formulas or like pre-digested. It's easier for babies to digest. Often these are recommended for babies who are at risk for allergies. So these so-called hypoallergenic formulas are much more costly than regular formulas. And so again, don't use them unless your pediatrician has recommended it. There's soy formulas which don't have cow's milk-based proteins in them. And so babies who are lactose intolerant may do better on a soy formula. Above and beyond that, there's other types of formula that are even more specialized, and they meet the needs of preterm babies, those that have galactosemia or other problems. So again, you can see how the answer to this question would be best answered by your pediatrician who knows what your baby's needs are. Generally speaking, at Intermountain hospitals, there aren't visiting restrictions on labor and delivery and mother-baby, and you can have whoever you want come and see you whenever you want them to come. They just need to be given a code by you, which is given to you after it's decided that you'll be admitted into the hospital. It's a 4-digit code unique to you, and you give it out to your family and friends. They present it at the door, and then they're able to come see you. All of the units at the hospital that involve children, labor and delivery, pediatrics, mother-baby, and the newborn ICU are locked and secure, and this is for the safety of our patients and their families while they're there at the hospital. Now, you wanted to know specifically if your children could come before and after delivery, and that's definitely okay. They can come at any time that it's okay with you. They just need to be accompanied by other adults so that you're not the sole caregiver for them while they're there. And they can come at any time during the day or the night because babies come at all hours of the day. So basically, it's up to you. With that said, sometimes visiting restrictions have to be put in place during peak flu season, and this is to protect newborns, new mothers, and members of the community from illness. So when you're a couple of weeks away from delivery, call the hospital you'll be delivering at, and they'll tell you if restrictions are in place at that time. You mentioned that your 6-month-old baby boy has become accustomed to eating solid foods on your finger, and you're wondering how you transition him from that to a spoon because he's not doing very well with a spoon. And really, the best way to do it is just to do it. I mean, it sounds simple to say. I know it's easier said than done, but stop feeding him food on your finger and start giving him food on the spoon, and be persistent and consistent about it. Don't give in and give it to him on your finger. And after you've done this for about a week or so, then he will adopt it as a new norm. You mentioned that you're 16 weeks along, and up to this point you've lost 6 pounds because you're just not interested in eating. It's more of a lack of appetite, and this could be due to the nausea that you're feeling during pregnancy. And if that's the case, talk with your OB provider, and number one, they'll be able to tell you if this weight loss is okay for you based on your pre-pregnancy weight. And number two, they may be able to prescribe a medication that will help you get over the nausea so that you'll want to eat. But as for what to eat to increase your desire to eat, that's entirely up to you. If something sounds good, then eat it. But you should fill your diet full of whole grains, lots of fruits, lots of vegetables, lean protein, low-fat dairy, and healthy fat. So if you can, choose a protein and a good healthy carbohydrate like fruits or a whole grain to eat with each meal and snack. And maybe try eating more frequent and smaller meals throughout the day instead of eating 3 large ones. And you might find that just keeping your stomach a little bit full all the time with a protein and a healthy carbohydrate will also ease your nausea and maybe help you eat the amount of calories you need and gain the appropriate amount of weight. The amount that you should gain during pregnancy is based on your pre-pregnancy weight, and again, your doctor will be able to advise you on what that is for you based on their knowledge of your situation. Don't forget to keep taking a prenatal vitamin too. A lot of people think you just take that while you're trying to conceive, but it's also important to take over the course of the entire pregnancy and while you're breastfeeding, because it helps to ensure that you and your growing baby have all the nutrition you need. So that's important too, in addition to a healthy diet. You mentioned that you had a baby 3 weeks ago, so first of all, congratulations on that. But you also mentioned that you had a C-section, it's hurting really bad when you urinate. You called your doctor and they didn't do anything about it at that time, but your symptoms haven't subsided. So I do recommend calling your doctor back again, and after asking you more specific questions, they'll be able to decide if further investigation or treatment is necessary. There's a few different things that could be going on, possibilities that your doctor will consider. When someone comes in and says that it burns when they urinate, one of the first things to think about is a urinary tract infection. And that's definitely a possibility after having a baby. So again, this might be something your doctor explores. I hope you found these tips helpful, and if you'd like to see more, or you have questions in the future ranging from preconception to pediatric and women's health, be sure to like this video, like our Facebook page, and subscribe to our YouTube channel by clicking on the link above.